2, 1.
Good evening and welcome to the COVID-19 vaccines webinar for young people. My name is Philippe and I'm from the Victorian Department of Health's COVID-19 immunisation program, and I'll be facilitating tonight's 60-minute webinar. Before we begin, I'd like to acknowledge the traditional owners of the land on which we are today. I pay my respects to the elders past, present and emerging, and to any Aboriginal elders of other communities who also may be online today. Shortly, we'll be joined by my colleague Steve Clancy, who will talk us through some tips and tricks about being COVID safe, how the state immunisation program is going, the much talked about final year student blitz, and we'll also touch on consent for those under 18. We'll then be joined by Dr. Stephen Liu, who will be joining us to talk about the vaccines themselves, their efficacy, COVID-19 variants, and also give us an opportunity to answer common questions that have been popping up about the vaccination program. We'll then finish off with a live Q&A to address any of the questions that you submitted when registering for the event, and also some of the questions from the chat as well. Please feel free to post any questions in the chat. If you have a similar question to a question that's already been asked, rather than re-asking it, what I'd ask you to do is use the thumbs up icon to indicate you also want to hear the answer. Tonight's webinar will be recorded and the slides will be distributed after to everyone who registered. Now, without further ado, I'd like to introduce Steve Clancy, who will talk through some general information about the vaccination program and eligibility. Steve, over to you.
Thanks, Philippe, and thank you everyone for joining us tonight. I know that everyone's probably got very busy times, and it's great that you've taken the opportunity to hear a bit more from us about the vaccine program. The slides that we're going to go through now, you will get copies of them, so I'm not going to read them out word for word. Some of them are designed for you to read at your own leisure. So I'll just sort of say advance slide to the next one as we go through, but don't fret if you don't get everything down. You will get a copy of these slides. We go to the next one. There we go. So there probably hasn't been a truer statement that the vaccine program in Australia has been rapidly changing and has had to scale up to meet vaccination demand. There's a very famous person there getting vaccinated. It's Brett Sutton. And I'm sure you'll appreciate that that was some months ago now that he was able to get vaccinated. And for a lot of young people like yourselves, it's probably been a time where you've looked around, and because of the very scarce and vaccine, we've had to look at how we really manage supply and eligibility. I've seen lots of older people able to get vaccinated, and now, thankfully, it's young people's turn. And so it is great that you've all shown interest in this, and we really hope you take up the opportunity to get vaccinated. Next slide there, yep. So this one, I just want to call out some of the pillars of our program. What we have really tried to focus on is, in a constrained environment, how we look at keeping good access and supply. And we hold lots of sessions like this one where what we're really trying to do is build trust and confidence in the vaccines, answer questions, really get you to understand what exactly it is that the vaccines do. And of course, our major focus is around insurance safety. Safety and quality standards are what underpins this program and is a real focus of everyone in the program and what we do. Next one there. So just before we get on to some of the community messages, there's a really important thing we need to point out, and it's just that we are in an outbreak. Victoria does have exposure sites, and it's important for everyone to know those exposure sites. They're updated regularly, and there's a link here that you can actually use to actually check where they are. And keep in mind that if you see sites that are around your local area, make sure that your friends and family are aware of those. Make sure that people that you think may not always be checking those sites, if you see somewhere that you think someone may have actually gone to somewhere like that, you know that they frequent that place, give them a call and see if they are aware that it is actually a site, because it is super important that we follow the directions of the health department when you actually attend one of those sites. And we can't say this enough, but if you have any cold or flu-like symptoms, and they are cough, fever, sore throat, shortness of breath or runny nose, even if they're just a mild niggle, you must get tested. It's so important to get tested straight away. Don't delay. There is no more important activity than getting tested if you experience any of those symptoms. I'd just like to also point out that we have 1,920 active cases in Victoria at the moment, and they are impacted by young people. So we have 305 that are aged between 10 and 19 years old, and 498 aged between 20 and 29. So this variant of the disease that we'll hear more about later, it really is impacting young people. So I just want to call out the importance of checking in. It is super important. I know it is something that's drilled into a lot of people. Checking in at facilities. Young people, you guys are out and about as much as you can be in lockdown. But if you are going to places, just make sure that you do check in. It's one of the key things that you can do to keep yourself and others safe. You'll see from this slide here where getting vaccinated is actually only part of the solution for us. In this pandemic, there's lots of other COVID-safe behaviours that really do make a difference and will continue to make a difference as we travel towards higher vaccination rates. There will still be things that will be important for us all to do. So they are social distancing, wearing a mask is just a simple thing and it makes a big difference. And of course, as I mentioned, that any symptoms, just get tested, stay home and isolate and keep others safe. The key thing to remember about vaccination is it's not just about keeping you safe, it does keep others, loved ones safe as well. They've been used in Australia and are very effective at preventing serious injury, hospitalisation and loss of life. So you'll hear some of the stats later on in this, but what we can be really confident in is that these vaccines are very safe. And there's lots of opportunities now, which we'll talk about, that now that so many Victorians are eligible to receive vaccination, there are a lot of pathways to actually getting tested and a lot of pathways now for vaccination as well. And a key thing to remember is that you do not need to have insurance. Everyone that's eligible is eligible regardless of their visa status. You do not need to have a Medicare card. If you have one and you have an appointment, bring it with you. But if you don't have a Medicare card, that is not a barrier to getting vaccinated at all. So eligibility used to be a very complex thing for the Victorian vaccination program. Now we're down to one slide, which is a very, very welcome development. Everyone aged 16 years and over is eligible in Victoria. Young people aged 12 to 15 years are eligible if they have an underlying medical condition, and that includes a disability, and also Aboriginal and Torres Strait Islanders that are between 12 and 15 are all eligible to get vaccinated through state-run centres as well. You may have heard from announcements from the Commonwealth that 12 to 15-year-olds are eligible through their system from the 13th of September. That is correct. So that is through GPs, and you'll probably hear a bit more of that later in the presentation as well. But a key thing for everyone to know now is that 16 years and above, you are eligible. We know with that eligibility has come a real increase in demand, and there is a commitment from the Victorian government to support students that are in their final year of secondary school to get vaccinated. We've seen it as a very important thing as we lead into exams. So we do have reserved appointments for these people, and we'll read some of this out because the following people can access this student blitz, we're calling it. All Victorian Certificate of Education students undertaking units 3/4 subjects, final year Victorian Certificate of Applied Learning, so that's VCAL, international baccalaureate students, teachers who support final year school students, BC exam supervisors and assessors that support final year school students as well. Now, the Blitz has started. It started on the 7th of September and is going through until the 19th of September. So it is now is the window to act if you qualify and are eligible as one of those things that I've just listed. And you're probably thinking, well, how do I act? And the answer is to, if you haven't been given any communication about this from your school, get in touch with your school. They will be able to tell you how you can access these appointments that are specifically for the final year student blitz. Now, I just have a few slides to go through here on the actual vaccines that are used in Australia. And I'm sure you would have heard of the two that are in use, and AstraZeneca is one. It is a very, very safe vaccine. It is available for adults 60 years and over. That's the advice that we are following from ATAGI, that is the cohort that will be offered AstraZeneca vaccination. It's important to make an informed decision and discuss individual benefit to risk when thinking about AstraZeneca and other vaccines. And the most important thing to do is, if you have any questions, a trusted GP is who you should talk to. There is more information on weighing up potential benefits in some of the information that we've provided in slides here as well. Now, this is the vaccine that most people on this call is most likely going to be interested in, which is Pfizer. So for people under the age of 60, Pfizer is the preferred vaccine. And also it is available for healthcare workers. And I won't run through the whole range of workers that are also eligible to receive that. But for most people, the important thing to know is that if you're under 60, Pfizer is the vaccine that is recommended for you. Now, pathways for vaccination. If you are not part of or eligible for the student blitz, these are the pathways that you should be aware of that you can use for vaccination. So we have a 1-800 number there that can be called, and you can book through that 1-800 number. There is also an online booking system, which is very popular, and there's a link there that puts you through to an online booking system. You could also look at participating clinics, and that is through, you can use the eligibility checker, and that will tell you which GP clinics in your local area are actually able to provide you with an appointment as well. So, as I mentioned earlier, in Victoria, we have built this program up to really try and meet supply. So there are lots of different ways now to actually get vaccinated. We've tried to introduce a system that's really flexible. We do things like mobile inReach for particular cohorts. We're doing things like this student blitz, looking at all ways we can to get as many people that need to get vaccinated in as easy way as they can, and making sure that access is not an issue for people. So there's lots of different ways that we've got avenues in. And I will call out again that GPs is one that it is worth using the eligibility checker to check if that's there's appointments in your local area too. Now, I know this is something that will come up in questions, particularly for young people that are under the age of 18 and around consent. And I will just read this question out because we know that it's one that a lot of people are interested in. I'm age 16 or 17. Does my parent guardian need to come with me on the day to provide consent? And the answer is no. An experienced immuniser will be on site to undertake consent. A parent or guardian is not required to attend the appointment. But that changes when the age is 12 to 15. So this question again, if I'm aged 12 to 15, does my parent or guardian need to come with me on the day? And the answer to that question is yes. So those 12 to 15-year-olds do need to have a parent or guardian in attendance at the appointment. And as I mentioned earlier, you don't need to have a Medicare card to access vaccination in Victoria. There is a simple process you can go through to get what's called an individual healthcare identifier, and that will help you get vaccinated. There are actually ways that you don't have to have that, but it is worth exploring getting that IHI card because it gives you proof of your COVID-19 vaccination. So you can ask for your GP if you're not sure about that, but the main thing we want to get across here is not having a Medicare card is not a barrier to getting vaccinated. Now, this chart here is one that is certainly one to have a closer look at when you get the slides yourself, and you can look at your own leisure. But what it really shows that down the bottom is this bottom bar is 16 to 19-year-olds. So if you have a look, you can see that it's something like 3% are actually fully vaccinated. And of course, that's not surprising considering eligibility has only just been changed so that those people are eligible. So what we see through this middle part of the graph is we see that there's higher vaccination rates. Of course, there is for those that in those older age groups that had longer to get their vaccinations. So what we're really hoping in the next phase of our vaccination program is we'll see this lower part of the bar, we'll see a lot more orange as everyone from 16 upwards starts to get vaccinated, and we'll see those first dose and second doses come through, and that lower part of the graph will become wider still, as well as the older age groups also continue to go up as well. I will now hand it to Philippe.
Thank you very much, Steve, for giving us that fantastic overview. And I think it just really highlights that if you are a final year student, have a chat to your school and you can access a vaccination for you. If you aren't and you still want to access a vaccination, there are many options and avenues for you to go down, whether it's through a state centre, your local GP. Have a look around to see what's available for you. Now, I would love to take the absolute pleasure to introduce Dr. Stephen Liu. Dr. Stephen Liu graduated medical school with honours from Monash University and has been practising as a specialist general practitioner since attaining his fellowship with the Royal Australian College of General Practitioners. He also holds a diploma in child health from the University of Sydney. His areas of interest include geriatric medicine, adolescent health, preventative health, general practice, general medicine, and general family medicine. His clinic is located in Mount Waverley. So, Stephen, over to you.
Thanks for the introduction, Philippe, and good evening, everyone. So I'm the second Steve to talk tonight. Look, I just want to start off by saying, even if your lives have not been directly touched by COVID, and I hope they haven't, the measures that we're adopting to contain the virus, like the lockdown, has been really hard for everyone, but young people in particular. You know, you're going through school, you're studying, and if you're struggling, speak to someone. You know, you can speak to your school, you speak to your family, and you can also come speak to your GP. You know, we all need a little bit of extra support, and we hope that support's there for you. And look, and on the brighter side, you know, once we get people vaccinated and protected, things will get better, and we want life to sort of start coming back to normal. Look, there's sort of 3 dimensions to the information that I'm going to chat about today. They are about COVID itself and this invisible danger that's out there. There's the non-vaccine measures is the second dimension, and the third dimension is the vaccines, their efficacy, how effective they are, and their safety. So I hope to touch on all those things, and if you have any questions, please put it in the chat and we'll try to address them. And as I go through the slides, I'll try to sort of address some of the questions that we've already received as we go. But just to reiterate some of the things that Steve said earlier, it is very important that we still address all the non-vaccine based measures, because there's just no single intervention that is perfect at preventing spread. So, you know, checking in and wearing masks and socially distancing and all those things are still very important. If you have any symptoms, getting tested, that's really important. One of the favorite updates that I've had this week is the check-in app has been updated, and now you can save a favorite spot. So I'm not scanning at the local Woolies, you know, like 14 times a fortnight. So that's been nice. So let's get to it. So next slide, thanks. All right, so first up, we're going to talk a little bit about the vaccine development. And I might sort of refer back to this as well. This is one of the common questions that I get, which is, this vaccine seems to sort of come out very quickly. And I heard that, you know, normally it takes ages to develop a vaccine, anywhere between 5 and 10 years. This sort of came out very quickly. It's important to note that even though it's come out quickly, no critical steps in the development have been skipped. No shortcuts were taken. A lot of the stages were overlapped, as you can see here, to try to get it out as quickly as possible, but no safety measures or testing have been skipped. And I'll also talk a little bit about the technology which have enabled us to do it a bit faster. And obviously this virus has turned the world upside down. So the demand was also, you know, unbelievable. So there's a lot of attention and resources, which is how we've come to have these fantastic vaccines. Next slide, thanks. What I alluded to earlier, the technology that have yielded our vaccines, the available vaccines now, didn't sort of pop out in the past 18 months. There's been decades of science and research built onto what we have now. So, you know, from the discovery of like messenger RNA all the way through to different sort of applications and studies. And really, it's just unbelievably lucky that we're in a place that the technology was mature enough for us to be able to do this. Because if it happened like 10 years ago, you know, I just can't imagine what sort of calamity we'd be dealing with. Next slide, thanks. All right, so look, I'll talk a little bit more about this because I think it's important. So the traditional vaccines work in a number of ways. So I should say, vaccines all do one thing, which is to teach your body to recognize a danger. And we've done this, there's a few different types of vaccines out there. So sometimes we have a live virus vaccine. You can have a dead virus or pathogen, I should say, vaccine, a dead virus or bacteria, or you can have a toxin, or you can even have part of a pathogen that forms the vaccine. So, but the new vaccines actually don't work this way. The new vaccine is actually incredibly clever in the way it works. So that's both the Pfizer, BioNTech, and the AstraZeneca. So if you imagine a pathogen, like something that could infect your body, like a bacteria or a virus, if you picture that as like a soldier wearing like camouflage uniform, for instance, and wants to get into your town, the traditional vaccine developments would be, like I said, you know, a live weakened virus. So we you know, one of these soldiers, they're weakened, and then we bring them into town. They're still alive, but they can't hurt us. And then we recognize the soldier. So if more come, we can fight them off. Similarly, you know, it can be like a dead soldier, right, coming in. We can bring them in. It's not going to hurt us, not going to infect us, and then we recognize it. So a live vaccine would be like the measles, mumps, rubella vaccine, and a dead vaccine would be like the seasonal flu vaccine. We can also target, you know, for some pathogens, for some bacteria or viruses, it's toxin. So that's like the soldier's weapon. You know, we have a look at its weapon, and then we know, okay, we don't need to fight off the soldier. We only need to deal with its weapon. So that's a toxin. So the common one we use there would be like the tetanus vaccine, which is we're teaching the body how to protect against the toxin that actually hurts us, and like a partial one. So, you know, it's like the soldier's hat or the soldier's pants or something like that, right? And we bring that into town, everyone sees it, and we know how to recognize it. So that's like the hepatitis B vaccine. Now, the really, really clever thing about the COVID vaccines is instead of any of those traditional methods, what we're doing is we're not using the soldier at all. We're not exposing anyone to the virus, live or dead. There's actually no virus there's no COVID virus in any of the vaccines. What it is, it's actually like just imagine an envelope with an instruction in it, right? and then we deliver the instruction, and we use the factories inside of the town, which is in this case your cells, to actually manufacture in town part of the virus. So in this case, it is the outer casing, or you may have heard about the spike protein. So if you think about the spike protein like the camouflage gear that the virus wears, it actually needs that to get into your body. If you imagine a soldier wearing camo gear sneaking into town, that's sort of what the spike protein does. It allows the virus to get into your body. So what we've done is we, I guess, get the vaccine delivers this message, an instruction for your cells, for your own manufacturing capabilities to manufacture the enemy's uniform. And then once we manufacture it, we recognize it and say, this is the enemy. So if we see it in real life, we know how to protect ourselves against it. So I hope that all makes sense. And it's important to sort of understand that concept, because one of the questions that we got was, if you've been fully vaccinated with either Pfizer or AZ, are these vaccines still relevant for the Delta variant? Would you still be protected? And the answer is absolutely yes. And I'll go through a bit of data on this, but if you understand the science behind it, the enemy can only get into your body if they're sort of wearing the camo gear, right? And if they evolved into a way, if there's another variant that came out that didn't have the spike protein, it actually wouldn't really scale. It wouldn't really track, because it won't be effective getting into your cells. So that's one of the reasons why these vaccines are so incredibly clever and continue to be very effective against the Delta variant. So another question that we got was, why push us to get this vaccine, which is based on the Wuhan COVID, not the Delta variant, which is the problem right now. So I hope that answers that question, and hopefully, I imagine it will still be effective, even if there's more variants coming on, because COVID viruses get into your body using the spike protein. Next slide, thanks. So I've sort of talked about this. We'll just keep moving on. So the Pfizer, so basically, the message is delivered in a slightly different way. The Pfizer vaccine, the message is directly an mRNA message, right? That goes into your cells. That's why you may have heard of, so the mRNA, it's direct, but it's slightly unstable, which is why you may have heard that Pfizer vaccines need to be kept super cold before they're thawed, etc. Whereas the AstraZeneca vaccine works in a slightly different way. You can have a read of these slides. They're very good slides later, but the way it works is as I described. So it's still delivering that short message to your cells to manufacture part of the virus for your immune system to recognize. So I think I sort of answered this already. We might go to the next slide, because I do want to talk about Delta in a bit more detail. All right, so variant of concern, Delta. The Delta variant is incredibly dangerous. It's got an increased risk of hospitalization, not by too much, but the biggest danger to Delta is its significantly increased transmissibility. We know this from data overseas. We know this from experience locally. So in America, I think earlier in the year, around April, May, the Delta variant only accounted for 1% of all of their infections. And by, I think, late July, Delta accounted for more than 90% of all infections. So that's how transmissible it is. And because it's so transmissible, it sort of overtakes other variants. And what we've seen locally here is, if one person gets it in a family, they're going to pass it on to every single other person in the family, whether you got 3, 5, 7 people. If there's a family of unvaccinated people, no one will be spared. And another thing that we're seeing in real life is, despite all the significant measures, our case numbers are still going up. And a big reason there is just the increased transmissibility is very, very hard to deal with. The original alpha strain, on average, one person can affect maybe two people, but Delta on average can infect 5 people. And you know, there's more sort of features about Delta that makes it so transmissible. So you know, when you sneeze, you have virus particles. If you're infected, if you sneeze, you have virus particles in your nasal cavity and in your nose. Compared to the alpha variant that we were dealing with last year, you have 1,000 times the viral load inside your nasal cavity. So it's really incredibly transmissible. But like I sort of described earlier, and I will talk about a bit more about sort of efficacy. Both AstraZeneca and Pfizer vaccine protect against severe disease and hospitalization, particularly after receiving both doses. And you know, I don't know if anyone sort of was watching the Daily Presser today. I think it was today or yesterday. Of all the hospitalized Victorians with COVID, I think there's 111 Victorians who are hospitalized with COVID at the moment. Of the 111, 99 of them were not vaccinated and 12 were partially vaccinated. None were fully vaccinated. And of the partially vaccinated ones, you know, we don't know if they just had their vaccine like 2 days ago, so maybe the immunity hadn't kicked in. So there's real world data that both are very, very protective. Next slide, thanks. Steve already talked about this. The benefits of vaccination, any vaccination really, you know, AstraZeneca, Pfizer. In fact, if you know, we're getting Moderna in I think October, that's coming in. The benefits of any vaccination greatly outweighs, you know, the benefits greatly outweigh the risks of any adverse effects. For the AstraZeneca vaccine, people talk about the blood clots. And again, they're very, very rare. So it's about 1 case, 1.5 cases per 100,000 doses. Next slide, thanks. Yeah, so I'll elaborate on this a little bit more. I think earlier there was a lot of talk about, you know, the blood clots, you know, with the AstraZeneca. Now, it is a very, very rare side effect. Like I said, around 1.5 per 100,000 doses, which is significantly higher than getting in a car accident. And if you do get it, it's treatable. So yes, there have been cases of where people have died as a complication of this clotting disorder. I think of 8 million doses given in Australia, there's been 6 or 7 deaths associated with it. So the risk of dying from this is 1 in a million. The symptoms can start anywhere between 4 to 30 days after vaccination. It is a fairly significant symptom. So you'll know something's wrong. And if you think something's wrong, or if you just have concerns, see your doctor. You can go to hospital. And it's also important to know, like I mentioned, if it happens, it's only serious if you have further complications, and it is treated effectively. And earlier diagnosis and treatment can improve the outcomes. Next slide, thanks. Okay, so so I imagine, you know, most young people will be getting the Pfizer vaccination, and people may have heard of, you know, there is a rare side effect associated with that as well, myocarditis or pericarditis. So what these conditions are is your heart sits in your chest, and it's protected by like a fibrous layer. So it's got this little fibrous sort of pouch that houses your heart, and it comfortably beats inside there, and it protects your heart. So pericarditis is the inflammation of this outer fibrous sac, so, you know, pouch. It's very rare. It happens a bit more in men than women, this side effect. And for a young male who gets the vaccine, the likelihood of this happening is around 1 in 30 to 40,000. And I also want to stress that it is a very treatable condition. In fact, it actually happens after, you know, I probably diagnose 1 case every 2 years, just in a general practice setting. I'm sure cardiologists see it a lot more, and young people can get it. They can get it after just a normal cough or cold, like normal cold infection. And it is very treatable, and it's usually very self-limiting. You will have to go to hospital so we can monitor you closely, but the treatment's actually usually just some Nurofen. So we just monitor you, and it's really very treatable. It is quite uncomfortable. If it happens to you, you'll know, and just come see your doctor. So you get chest pain and shortness of breath and pain with breathing. Myocarditis is inflammation of the heart muscle. So it's like sort of one layer in from pericarditis, but the treatment is very, very much the same, and it is a very self-limiting condition. Next slide, thanks. So COVID-19 vaccination is supported by a huge range of faiths and religious leaders globally. They are certified halal, and they do not contain any tissue, any human or animal or cells derived from human or animal tissue. Next slide, thanks. So I think for young people and for parents of young people, this is a big one. I was just telling the team yesterday, 3 of my patients in a row came to see me asking about this specific question, and I was really happy I was able to put their mind at ease. There is no evidence that any of the COVID-19 vaccines have any effect on fertility. So it's good to note here that I think globally more than 5 billion doses of vaccines have been given, and vaccine safety is constantly being monitored. In fact, there was another, and we're constantly closely examining the different types of patients as well, and there's been no evidence whatsoever that the vaccines have any effect on fertility. And it's important to note here as well that there's never been any vaccine, not just COVID vaccines, but never been any vaccines, any of the different types of vaccines that I described earlier that have had any effect on fertility. If anything, it's probably protected people from the fertility issues that could arise from the diseases that we're offering protection from. So like a common one would be like the measles, mumps, rubella. Mumps is known to reduce sperm count and can cause fertility issues in men. And you know, we can mitigate that risk with vaccination. So being currently pregnant is also very safe. Again, another very big study, a very high quality study published in a blue ribbon journal, came out 2 days ago, reiterating this. But we already knew that pregnancy, it's very safe to have in pregnancy. In fact, it's recommended that pregnant women are vaccinated as early as possible at any stage of pregnancy. And Pfizer is the preferred vaccine here. And like I said, there are no safety concerns for the women or baby. In fact, I think there's another slide later that actually talks about the dangers of not being vaccinated should pregnant women come in touch with COVID. And it's safe to continue breastfeeding before and after COVID-19 vaccination. So my wife's currently breastfeeding, and she had her vaccines throughout during her breastfeeding. And there's no evidence of any side effects. In fact, hopefully, some protection may even be passed on, like some other vaccination effects, but we'll see. Next slide, thanks. Okay, so these are like the general side effects. You may experience some. Most of my patients don't really experience much at all. Some people tell me, I had half a day of feeling sort of achy, a bit of headaches, some joint pains. Very occasionally, some people get some chills and even fevers. So that's okay. These are all very, very self-limiting. They'll go away. With the AstraZeneca vaccine, you get a bit more side effects with the first dose, whereas Pfizer is the other way around. The second dose can give you a little bit more side effects. If you're really anticipating it, I guess you can maybe take the day off after, but it's in my experience, that's not even been necessary. You should just be able to carry on with normal things as you would. Next slide, thanks. Messages to remember. Yeah, so more than 5 billion doses have been given. We've talked about that. Vaccine safety is constantly being monitored. Safety issues are incredibly rare. And please talk to your GP or trusted health professional if you have any sort of personal questions. Information about pandemic conditions continue to change, just like they've changed this year, right? With the Delta variant, it's really, it's really changed the game. And at this point, with this invisible danger, this enemy that we're dealing with, we're sort of at a stage where we're sort of, you're either choosing to get vaccinated or you're choosing to get COVID, because it's just so infectious. I'm really worried about it. And the last thing is, look, media headlines can be misleading. Like I said, it's important to have a good framework to think about information. So like I said, the 3 dimensions, you want to equally consider, I guess, the dangers of COVID and the measures that we need to the whole series of measures and the non-vaccination measures that we need, including the lockdown, which is very hard, that need to be continued and need to be adhered to. And it's like sometimes it's annoying to have to scan yourself into places, but like every day I wake up, I check the weather and I check exposure sites. It's the user experience is better as well. It's more easier to navigate. There's a little map that you can just zoom in onto where you live and have a quick look. So there's been lots of efforts to make that easier. And obviously the last dimension is, the getting the vaccine safety, vaccine efficacy. Next slide, thanks. So before I go on to audience questions, there was just one thing with, so we talked about fertility. It also disproportionately, so COVID disproportionately makes pregnant women sick. So they're about 5 times more likely to be hospitalized, 3 times more likely to end up in intensive care, 3 times more likely to end up on a breathing machine. There's also new evidence coming out this week that it also increases rates of stillbirth. We know it increases rates of preterm labor, and it increases the chances of the baby needing neonatal intensive care by 3 times. So very important that pregnant women get vaccinated. So audience questions. So Philippe, I'll just jump into these. Yeah.
Absolutely. Look,
Yeah,
I'll read it out so you have a little bit of time to think. So probably the first one that came off the rank. I previously had an allergic reaction to a vaccine. What should I do for me if I do want to get a vaccine?
So that's a great question. A lot of my patients have come to ask me, say, look, I've had this allergic reaction in the past to a vaccine, so I'm a bit concerned about getting this one. Sometimes it's quite difficult to distinguish between what is an adverse reaction, so known expected side effects, versus what's a genuine allergic reaction. So for a mild allergic reaction, we may not be able to tell the difference, but we can tell the difference between a very severe allergic reaction, so anaphylaxis type of, which is a very dangerous, you can get very sick very quickly from. If you've had an allergic, it's good to talk to your doctor about what actually happened, what type of reaction you had, to try to tease out what, was it an adverse reaction or an allergic reaction? Now, some people do have a genuine severe allergic reaction or anaphylaxis. So you hear about severe peanut allergies, that's usually anaphylaxis. Now, anaphylaxis can occur with the vaccines. So the rate of anaphylaxis for Pfizer is 1 in a million. The anaphylaxis rate for AstraZeneca is 1 in, I think, 3.4 million. So it is possible that people get a severe reaction. We're not going to know because it's the first time you've been exposed to this vaccine. There's no real, having an allergic reaction to a previous vaccine does not predispose you to this one, but it's good to talk to your health professional about it. Actually, someone's lobbed a softball question. I might just answer this one first. Has Stephen Liu had a vaccine, and which one did he have? So yes, I've been vaccinated. My wife's been vaccinated. My mum and my mother-in-law have been vaccinated. So my wife and I both got Pfizer because that's the age group that we're in terms of age group eligibility and being healthcare workers. So my parents got AstraZeneca because that's their age group. That was the whole question. So I thought I'd just knock that one out. The next question on here is when will children aged under 12 become eligible for COVID-19 vaccination? Again, another fantastic question. I imagine that's some stage soon. Overseas, they are starting to vaccinate younger children. We will closely observe the safety profile there. If you heard my description about the vaccines themselves, you can understand that. And we vaccinate children with all sorts of things to make sure they're protected. I think it'll be very safe, but the approach that we take in terms of lowering the age group is one that is very, very cautious. So we do examine the data very closely before we roll it out. And the advantage here is, even though young people are getting it, COVID, thankfully, has not been one of these infections that disproportionately makes young people and children sick. So so from that thinking, they're going to be probably the last group to be vaccinated, but I think they will be soon. Next question: why are more young people getting COVID-19 this year? I think multifactorial. There's quite a lot of reasons there, and one of the reasons is which Stephen Philippe sort of alluded to earlier. To protect the most vulnerable of our community, we've decided to vaccinate older people and those people and people with chronic conditions first. So young people were the group that were least vaccinated and least protected, combined with the increased transmissibility, the significant increased transmissibility of Delta, and also among young people, and that includes people in not just high schoolers and uni students, but also kids in early learning and kids in primary school, and it's very difficult for them to socially distance and wear masks and wash their hands and not touch their face, and they all play together. So I think they're probably some of the reasons. Can vaccination prevent me catching and passing on COVID-19? Terrific question. So are the vaccines effective? Absolutely, but we also need to tease out effective at what. So we know that being fully vaccinated, you get anywhere between sort of 70 to 90% effectiveness, probably close to 90% effectiveness if you come in touch with the virus. It protects you from catching the disease. But there's still another sort of 10-15% out there that can still catch it despite being fully vaccinated. We call that a breakthrough infection. And if you do have a breakthrough infection, the vaccine continues to protect you from severe illness. So it could be the difference between having to go to hospital or staying at home. And just having like cough and cold symptoms, and you do need to isolate and get tested and and keep yourself a bit more comfortable. But if it can protect you from the infection hurting your organs, hurting your lungs, getting you really sick, and where you end up needing to go to intensive care, and protecting you most importantly from death. And we know it hurts. Obviously, we know it hurts people. But it does hurt young people too. And, there are young people, even though maybe less frequently, but there's still young people getting very, very sick. And we hear about young people dying on the news with COVID. And there's young people in ICUs in Sydney, in Melbourne with COVID. And in addition to that, it can hurt your families. It can definitely hurt your older family who might have chronic condition. Now, this is the thing about Delta. Again, Delta is very difficult to deal with because despite being vaccinated, if you have a breakthrough infection, even if you don't get really sick, you could just have cough or cold symptoms, you can still pass it on to other people. The transmissibility is quite similar if you weren't vaccinated, which is why all the non-vaccine measures are still critically important. If you're sick, vaccinated and you get sick, please still go get tested. Get tested right away. Isolate yourself from other people until you get your results. Wear a mask, wash your hands, and if you're sick, steer clear of family that that might be vulnerable to the disease. Next question is, how can I have a conversation with vaccine hesitant friends and family about vaccination? That's a really great question. And in fact, I think one of our sort of separate questions, we got another question through the Q&A, so which is similar. It's been like a really difficult 18 months, and everyone's lives, you know, either directly or indirectly have been made worse by COVID. And like I said, you know, for all people, not just young people, for all people, it's been a really difficult time. So, you know, you could be low and sad and depressed and, you know, anxious, and you read the news and you read social media and you could be fearful, and there could be misinformation out there. Everyone's emotions have been really challenged, and everyone's just sort of tightly coiled. So it's really understandable that people can be fearful or upset, or they read something and, you know, they could get angry. So I think these are all really understandable thoughts. So the first thing I tell my patient, the first thing I tell everyone is there are no dumb questions, right? Any question that stems from having a concern for yourself and for your well-being is valid. So the way that I would recommend, the way that I would suggest, and Philippe, I think we have some like resources on this that we can share, but the way that I would suggest you approach your friend or family is, you know, one is to be empathetic. Everyone's had a tough time, even if they come across a bit sort of, abrasive, or you might think they're difficult. Try to think what a difficult time that they might be having. And the other part is so being empathetic, and the other part is being curious. Have a conversation, just hear what their thoughts are. You know, what are you worried about? Because they're usually, you know, anchored in something that's true. So look, I get a lot of questions about fertility, and you know what? Super valid question. And if there were, a concern about fertility, if there was a problem with any sort of treatment that affects fertility, which there aren't with the vaccines, thankfully, but if it were true, it'd be a real serious concern, right? So it's important to be curious and try to have an open dialogue. And, you know, sometimes there is a temptation where, you know, especially within families, I think, you know, I had experiences with my own family, there is a temptation to slam dunk on them with like some real science, but that's not what we really need. We do want to just be compassionate and be empathetic and just listen, you know, and just be curious about what's concerning them. And that usually helps a lot. And then you can sort of direct them and say, look, you know, they're valid concerns, but, you know, can I share with you something that I learned through a talk? And that might be a good approach. And the last question on the slides is will the COVID-19 vaccine affect my menstrual cycle? I don't know. I don't think so. My only hesitation is I look after a lot of young women, and sometimes menstrual cycles are quite hard to predict. So if you have any specific concerns about menstrual issues with respect to the vaccines that are more personal, specific to you, please make an appointment and go talk to your GP. Is there another slide?
No, I think at this point we're going to open up to the Q&A that's in the chat, and we'll have a little bit of a look through as some of the questions that we've received. Sure. Now, Stephen, there's quite a few, so let me just give me a second and I'll let you catch your breath because you've been talking for quite a while now. Let's have a quick look. Okay, so we've got this question here. Is the Pfizer vaccine safe for people to take if they have an autoimmune condition? And additionally, are the vaccines less effective for someone with a weakened immune system? Bit of a double whammy in that one.
I think, yeah, so these are really fantastic questions. I'll answer the second one one first, right? So are the vaccines less effective for someone with a weakened immune system? The question here is, how weakened is the immune system, and through what means has the immune system been weakened? So I look after a lot of elderly people who have, heart failure, kidney failure, really bad diabetes, and those things all weaken your immune system. But the mechanism of the vaccine still works very effectively for them. There are specific situations where people might have, say, hematological, so blood-borne disorders like leukemia, lymphoma, those people under chemotherapy, and very specific types of immunotherapy. The vaccines have been very effective for them, but it may be less effective. And the way to counter that is some of these patients will require a third dose. Some of these patients will require earlier booster. And the person to talk to that about is their domain specialist, whichever specialist is looking after the problem, which may be a cancer specialist, it may be a hematologist. But for the most part, like I said, those general, and the elderly, growing old also weakens your immune system. So for the, I want to say, like mainstream weakened immune systems, the vaccines are incredibly effective. And let me go back up and answer the other question. So autoimmune conditions. So again, for the most part, absolutely. So having an autoimmune condition is not a reason why you can't have the Pfizer vaccine, is not a reason why it would not be effective for you. But with autoimmune conditions, it varies a lot. You could have a mild thyroid disorder, right? Or you could have very well-controlled rheumatoid arthritis or Crohn's disease. And it really depends on the state of your condition, and the best person to ask is your domain specialist. So in this case, it may be a rheumatologist. And it really matters what treatments you're on as well, because some treatments do augment your immune system. So for a lot of people with autoimmune conditions, the treatment is actually to artificially weaken your immune system so your body doesn't attack itself. But the best question, the best person to answer this question for individuals are their relevant specialists. But for the most part, absolutely, it's very safe.
Beautiful. We'll go to this question now. Why don't we just let the body's own immune system just fight the virus naturally? Why do we need these vaccines, Stephen?
Yeah. So look, that's a good question. For some, changing, I guess, the body's immune system artificially seems a bit unnatural. And one of the main reasons why we don't just let the body's immune system fight the virus naturally is because you could lose, is because you can get really, really sick and you can lose your life. So yes, you can put up a fight. And a lot of young people might think, actually, I see the stats. I don't think a lot of young people catch it and they die from it, but it's not, death is a much easier number to count, but we do see this virus impacting your life significantly. People might have heard of this long COVID. So we hear about long COVID, which is even after you recover from the original COVID, a COVID infection, a lot of people suffer from really long-term consequences. In fact, there was a study out, I think, a week ago. So they sampled, they collected data from the original people who got infected with COVID in China. So this was like late 2019, and they studied, say, like how long did they have ongoing symptoms for, and about 60 to 70% of them still had at least one ongoing symptom at the 12-month mark. And this is something that we've seen clinically as well. So people who've recovered from COVID don't fully recover. So someone who's active and plays sports and cycles and runs, and this happened to a GP colleague of ours in Sydney who got infected earlier in 2020, and he was very active. And yes, he survived, but he's still, I don't think, as of earlier this year, he's still not back to normal. He still can't cycle, he still can't run, or he still can't have the same level of activity or concentration as he did. So it's really very, very dangerous. And it's a really big gamble. And I think this is a great point to think, to appreciate how much vaccines, just in general, not just COVID vaccines, but vaccines in general, have been the most impactful, revolutionary treatment that have, you know, reduced death and suffering and long-term damage to people's lives in the course of history. So, like I said earlier, there's never been any vaccine that's shown any long-term effects to fertility, to anything. You know, beyond side effects. If the side effect didn't happen in a month, it's not going to happen. But the things that have protected us from, measles has a long-term effect. It can happen like ages. It can happen weeks later. That can kill you. You get this panencephalitis. You get a brain inflammation, and you can die from that. So the author Roald Dahl's daughter died from that. Polio, which, you know, very luckily our generation haven't had to deal with it. You know, I've never diagnosed a patient with polio. But go online and Google polio, you know, like you see the pictures of the iron lungs and things. It really ruins people's lives. Like, you know, tuberculosis and, you know, hepatitis and all these things. You know, children used to die from Haemophilus influenza until they used to get meningitis from that. So some people can survive. You know, you can let your body's immune system just fight the virus naturally. But you can lose, and some people will lose, and that's the reason. And also for people who recover from COVID, you can then re-catch COVID, which, you know, traditionally we think if you catch something like chickenpox, you'll never get it again because you get immunity. We know that people who have caught COVID, suffered from COVID, recovered, they can catch it again. And so for people who've caught COVID and recovered, we actually offer them the vaccination. We actually offer them the vaccination to protect them. I hope that answers the question.
Absolutely. And I think that's a really good place to finish on. Stephen, that question was absolutely perfect and the answer was amazing. And I think really highlighted why vaccines are so important in our lives. And I want to thank everyone today. I want to thank Stephen for speaking to us, Steve as well, for taking the time out of your day to come and listen to us. We really value your feedback. So if you could just finish and access the 1-minute survey that's been put in the chat. A final reminder, please book in your vaccine. If you're in your final year, you can contact your school. They'll tell you how to book. Anyone else, if you want to book in, you can book in through the state system, either by that phone number or our online, or if you want to check your local GP, go through the Commonwealth to find that.
So sorry to interrupt, just one last message.
Last message.
GPs are receiving their Pfizer vaccine deliveries this week, next week. So if you prefer to, a lot of my patients prefer to get their vaccines with me at the local clinic, give us a ring and find out. So when are you getting it? Can I book it in? And the other thing is, if you book through the state portal, so I use the portal myself, if there's like no availability for a few weeks, just jump on and check again, because more and more bookings become available. And it's really very easy to use.
Thanks, Stephen. I absolutely want to echo that and couldn't have said it better myself. Thank you all for your attendance, and I hope you have a great evening. Good night.
Good night.